My client today is Natalie Bruin, and we're going to be giving her a dose of morphine and Gravol as well to help treat her pain and nausea. According to the patient's MAR, we're going to be administering 5 to 10 milligrams of morphine through an IM injection once every 3 hours for pain. It's important to check Natalie's respiration rate and to see if she's drowsy at all, because we do not want to give her this medication if that's the case. We are also going to be giving her 25 milligrams intramuscularly of Gravol to help treat her nausea. This is the first medication I'll be administering today. This is the Gravol, and I'm going to be administering 0.5 mils of Gravol. I will also be following up this by administering 1 ml of morphine. The first thing I'm going to do when completing the first check is verifying that it is the right patient and also that her hospital number is correct, and maybe look at her birthday and just cross-reference that with her medications. I'm going to start on the first page. We're not doing any of these meds today, so I'll move on to the next page. The first drug I'm going to be doing my first check on is going to be morphine, so I'm just going to be making sure that it is the right drug, and it is the right amount. So this one is good. And then next, we're going to be doing Gravol. It is the right drug. We'll be administering 0.5 mils of this, and we're going to be doing an IM needle. So that is the first check done. Before I go ahead and start drawing up my first drug, which is going to be Gravol, I'm going to perform hand hygiene with hand sanitizer. And so now I'm going to prepare my first medication, which is going to be the Gravol. I'm going to be putting 0.5 mils into a 3 milliliter 23 gauge syringe. I'm going to be placing the blunt fill needle onto it to extract it from the vial. The first thing I'm going to do is I'm going to draw up 0.5 mils of air just to aspirate it. I'm going to remove the needle cap. And then I'm going to draw up my medication. Ooh. I'm going to put the air in. I'm going to be drawing up 0.5 mils. So now I'm going to be completing my second check for the Gravol. So 25 milligrams of Gravol or 0.5 milliliters of Gravol. I'm going to compare that to my MAR, and this is correct. And now I'm going to cap it, and now I'm going to drop morphine to do my second check. My second check for Gravol is complete. Now that I have drawn up 1.5 milliliters of Gravol, I'm going to take off the blunt needle. I'm going to put this down, and then I'm going to perform hand hygiene once again before drawing up a milliliter of morphine. So now that I've done hand hygiene, I'm going to draw up 1 ml of morphine in this vial, but I'm going to be using a blunt fill needle filter. This is going to help prevent any glass shards getting into my syringe in the event that shards of this break off as I'm drawing the morphine. So I'm gonna unpackage this. What the fuck? Blunt fill needle filter. I'm gonna be placing this on there like so. Blunt fill needle filter is on. Now I'm going to be breaking open the ampoule and ensure that there's no air bubbles. There's no air bubbles. And I'm going to take an alcohol swab, and I'm going to clean the surface of it, and I'm going to remove the top of the ampoule. Clean, and I'm going to put this in a hazards bin. I don't have a hazards bin, but I would if I was in a clinical setting, Shauna, don't you worry. So I'm now, with my blunt fill needle filter, I'm going to draw up 1 ml. So in total, I should have 1.5 mils of medication in my syringe by the time that I'm done. So I have drawn up 1 ml of morphine, and I'm going to dispose of the rest of the ampule as well as remove any other garbage that I've accumulated since starting my med-admin process. Now I'm going to be doing my second check against my MAR for morphine. So I have 10 milligrams, aka 1 ml of morphine in my needle, and I can now go ahead and check this one too. There we go. So now that all my medication is in my syringe, I'm gonna place on the needle that I'm actually gonna use to be injecting Natalie today. This is my IM injection needle, and I'm gonna make sure that the safe is on until I'm ready to inject. For Natalie's injection today, we're gonna be doing it in her ventrogluteal area, which is kind of on the side by her hips. I'm gonna be taking my non-dominant hand, and I'm gonna be placing the heel of my palm on the greater trochanter of her femur. And then I'm gonna be having my 3 fingers, these ones right here by her iliac crest, and then my index finger by the anterior superior iliac spine. And then in between here on her leg is gonna be where my injection site is. I'm now gonna be doing my third and final check before I administer my medications to Natalie this morning. So we're not doing any medications on this first page, so we'll move on. First drug we have is gonna be morphine. So I have pulled 1 milliliter of morphine into the syringe. It is the right drug and is the right amount, and it's the right time. And then next I have Gravol. I have the right drug. I have 0.5 mils of this drug in my syringe currently. It's with an IM injection needle, and it's the right time as well. My third check is now complete. As I approach Natalie, I'm going to ensure that I do hand hygiene first, and I'm also going to put on gloves before I do my injection. So when I approach Natalie, I'm going to want to ask her some basic questions. I'm first going to want to ask what her first and last name is, just to ensure that I'm giving these medications to the right patient.
My name is Natalie Bruin.
I'm also going to want to ask her date of birth while looking at her hospital wristband, just to ensure, once again, that this is the right patient and match it to my MAR.
My birthday? Oh, my birthday is September 1st, 1953.
So now that I've confirmed that it is indeed Natalie Bruin that I'm giving her medication to, and she can tell me her birthday, and I've also assessed her respiration rate, which is more than 10, because if it's less than 10, then we cannot give her morphine. I'm going to ask her to lay on her side and expose the area that I'm going to need to inject, which is going to be her ventral gluteal area. And I'm then going to just quickly sanitize the area with a little alcohol swab. And I'm going to want to kind of place it kind of near my site so I don't lose track of it. And then at a 90-degree angle, I'm going to inject. And then for every 1 mil, it's going to be 10 seconds.
So it should be about 15 seconds.
It's important to make sure that you are looking and that you're aware of the patient if they're having any discomfort or anything. And I'm going to want to immediately cap the needle, put it to the side, and then swab the area with a gauze. I don't want to rub the area because it can cause skin inflammation and or bruising. Now that I've completed my medication administration, I have to make sure that I sign up on all my meds. Medications for Natalie have been administered, and I will check back on her shortly to see if she's still experiencing any pain or nausea. Now that I've finished my medication administration, it's important that I throw my needle in a hazards bin.